We're so excited to have our accelerated sites here presenting, and we're honored to have them tell about how the initial implementation of their initiatives went. So from Northern Michigan Care Partners, we're honored to have Brandi Eisenga and Beth Oberhaus here. Brandi is the lead care manager for Northern Michigan, or lead of care management for Northern Michigan Care Partners and Munson Healthcare. In this role, Brandi leads care managers across Munson Healthcare to improve workflows and understand billing, along with training for new staff. She is also the PO clinical lead for the MCT2D program. Brandi has spent the last 13 years as an RN in an informal and formal leadership roles. She understands the clinical aspects of primary care practices since she was a care manager prior to her current position. And Beth Oberhaus. Beth is the Director of Population Health for Northern Michigan Care Partners and Munson Healthcare. She has extensive leadership background in implementation of care management, transformation of processes, quality improvement, and population health technology implementations. Beth has been with Munson Healthcare for 21 years and Northern Michigan Care Partners for 12. So Brandi and Beth can come up here and give their presentation. That would be amazing.
Well, thank you very much for inviting us to come and share about being part of the accelerated sites. And we knew, going into the collaborative and being part of the accelerated sites, that there were going to be some risks that we would have to take, some challenges along the way. But regardless of all of those, we were definitely excited to be part of getting this collaborative started. So, when we were asked about how the collaborative, and doing the initiatives would impact our workflow, for many of our providers in our practices, this did not create a large change in workflow. A lot of them were already implementing a lot of these initiatives, so that workflow change was not huge, but where they did notice a fairly significant change would be in the time involved with patients. So length of office visit was definitely extended because the amount of time that the providers needed to spend with patients, doing some additional education. That's where they noted some of the biggest changes, as well as many of these patients required additional follow-up or more follow-up care than maybe they had been previously doing. So that created some, workflow changes within their schedules. The other part of the change that they noted would be just in the amount of collaboration and coordination that needed to happen within the practices. So we were noticing a lot more coordination with care management, or referring to the pharmacist if they had one available, or their dietitian, because just for the matter of time, the providers did not have maybe quite the time they wanted to spend with the education for a low carb diet, or the medications that the pharmacists or the dietitians were taking on that role for them. So that was a big change as well, and an improvement within the practices. I would say that really for our clinical staff is where we saw some of the greatest impacts and changes within our practices. Care managers were getting assigned and referred a lot more patients than what they had been.
Which was good news.
Yeah, which was really good news for us, as well as, like I said, the dietitians, if practices had one available, as well as I know our pharmacist in a couple of our practices, workloads were increased immensely. So, having to manage and support these patients on these medications, doing data collection, and getting CGMs available for patients. We even had a practice of ours had a designated care management staff who worked with CGMs with patients. So this MA would help with the referrals, monitoring the process from start to finish. how did this process go? Where is the referral at? What extra steps needed to be taken? Setting the patients up with sample CGMs in the interim while we were waiting for insurances to be approved, and just tracking that process because they were trying to look at what this workflow looked like. How long is this taking? What, kind of time is this taking? So one of our practices even did that, obviously a little clunky process to begin with, and it's still, working out the bugs, but some definite changes that were made just to try to implement as well as we could. So a lot of clinical changes, and even administrative and supportive staff, with the additional appointments or making bigger blocks for providers, more referrals that were being sent out for those supportive services for the pharmacy or dietitian. So just, managing.
We heard a lot about prior auths,
Yeah.
That process
Yep.
and how much time it took and the burden and trying to get processes in place. I think we didn't have a lot of pushback as far as wanting to do the program, wanting to do the 3 different interventions. It was just the how. And for some of our smaller practices that don't have as deep of a team, that is still the challenge.
Yes. So, and in terms of, implementing and operationalizing the initiatives, each of the practices approach to this looked a little bit differently just based on how that practice functioned. But in general, for most of the practices who saw the most success had very similar things that they were doing. Right off the bat, these practices had really, really engaged leaders. So they had a provider that was passionate about the collaborative and what it meant, and really took it upon themselves to champion the work, as well as, I think, communicating with the other providers in the office and educating and supporting the education that was being provided by the collaborative and how important it was to the practice. So these practices, we really saw, where they were getting the benefit and really, leading this work. So that was probably one of our biggest successes in getting it implemented when we had that provider engagement.
We had to make a line between our practices we say are being really successful and the ones that are still struggling. It would be the one thing that all the successful ones have is provider leadership, for sure.
Yeah, for sure. And, and within that, that communication with the staff and understanding the structure of that practice and the staff that was available in the practice, knowing the barriers and challenges within the practice and how do we make changes and implement changes, because we all know that many practices everywhere have gone through struggles related to COVID, and it's really changed workflows and processes within practices, but knowing how to gain a good balance between, those patients that need our help still related to COVID, but yet we want to continue doing improvements and, making change. So recognizing that and working through it, but then, with that, being able to create a clear role and responsibilities within the practices, knowing who you have available to work with, making clear designations to the care management, what's expected of them, what's expected of our front staff, what is expected of our providers, and having that clearly stated out and educated across the practices has made a huge difference when people actually knew what was going on. And again, just that communication piece and providing the education and the resources to staff so that everyone was aware really made a big difference in the success of each practice. So kind of to go off of what I was talking about, success in practices, some of the things that we have seen throughout this collaborative and getting things going was finding those champions in our offices, some of these providers who really have supported this change and encouraged change, especially even with our practices who have residents in their office, and getting them involved and educating and, you know, instilling the importance of the work that we're trying to do. And also living in a rural community and the challenges that we face with that, we had to be creative with some of the resources that we had and utilize them in different ways that we probably never thought of doing before. So like I was talking about, we've had practices who are getting our patients set up with a sample CGM while the patient's insurance is being approved. So we could get a patient set up at least for that 10 or 14 days, depending on, you know, what CGM that we were trialing, work with insurances, but then at least we're starting the work with the patient in hopes that the insurance would approve that CGM. So these are some things that we probably wouldn't have done before, but with the push to, you know, do this work, just making those changes. Also, talking to some of our practices that when providers are in the office or staff, recognizing that we did not have good process or workflows for them while they were in office to provide education to the patients at point of care. So we made some changes in offices, having education readily available in the rooms, providers can grab, making those workflows quicker, and just beefing up our education that we had available. As well as, I know many of them have just had such an improvement in education across their practices. Many of our staff, care management staff, were not super familiar with CGMs and, you know, how they worked and how to educate patients. So this was a huge step for a lot of practices because they just hadn't done a lot of that work. And
Yeah,
now,
if we could go back in time, I would have educated all the care managers at the same time we did education for providers. We did it after, and that was a mistake.
yeah. Yeah. So once, you know, we were able to provide some of that, it just made a world of difference in the, you know, the care that you can provide and the follow-up we're providing with patients. So that was a huge win for us, is just recognizing that and improving it. And I think a huge win for all the practices. And I think what a lot of the collaborative is truly about, not that it necessarily gets recognized that way, but this couldn't be done without the whole team. Like, I think this has proven that the work can't be done without each part of this team member. So that's why that's up there. I mean, every individual within a primary practice has a part of the programs that we're doing and the work we're trying to do for patients and to improve their care. So, you know, that was definitely recognized in just in the amount of patients and the workload that all of our staff saw, you know, not just the providers, but it was the care managers, the dietitians, the pharmacists, some of the other supportive staffs, you know, in the office. They're all a part of it because you can't make it work without everybody. So that was a definite win. And to have all of that, you know, you get better patient engagement and better success for improvement. So this was just a story of one of our patients that I just wanted to share. So the patient was started on a GLP-1. You know, you can see the decrease in the A1C, also weight loss of 22 pounds. And even the provider was able to discontinue the patient's basal insulin. The patient had frequent follow-ups in the clinic with the pharmacist, but then the pharmacist was able to provide the education, answer questions for the patient. But through that direct coordination that the pharmacist had with that patient, it allowed them to make quicker adjustments within that treatment and the therapy to prevent, other like hypoglycemic events. But just like I said, having that whole team be able to do this work allowed for a good outcome for the patient. So, and just to show that the use of our initiatives that we're trying to implement has improvement for that patient too.
And we're totally using this story to help try expand pharmacists in all of our locations, because that's been the other key of success. So Heidi didn't pay me to say that.
You're welcome. So like we kind of touched on a little bit. So we are, Northern Michigan. We have practices all over the region up there, and many of them were all rural. So our patients, this is a big challenge for us. Our patients access, we have a very low income across the board. A lot of these patients have low household income, not a lot of support in the home. And sometimes even, on the clinic side, specialty clinic, there can be not a lot of support for the patients like we would want, and a very low health literacy for all of these patients. So it can be tough when we're trying to encourage patients to come into the office and do those follow-ups and get the medications that they need, or a CGM. So that is definitely a challenge. One of the big things is just the limited access that we have for specialty resources like endocrinology, even dietitians. A lot of our resources went virtual with COVID, and not a lot has come back yet. In living in a rural community, and honestly, the patients that we're trying to implement, a lot of them don't have access to internet. Where they live is just not a possibility. Many of them don't have a smartphone. So like to do even a virtual appointment is challenging, because they don't always have access to this. So that's where our care management staff has been really vital to this program, because we can make those phone calls to the patients and do the low carb education and that additional work that's needed, because that's what we have for a resource. That's what these patients have access to. They don't always have access to the dietitian or have a way to get to the office. Many of them don't have transportation. And I'll be honest, with COVID, the medical non-emergent transportation has been very, very challenging. It is not reliable, and patients often miss appointments because there is no transportation available. So that's where our staff has really come into play with the additional education that's needed for the program and that follow-up. So just some additional ones out, outside of that, just the being rural. And I'm sure that this is a challenge for everybody, prescribing the CGMs and medications and getting them covered. Having just a streamlined workflow with this has just been a challenge from the get-go. We've had patients, we start them with a sample, but then their insurance denies, and there's just nothing that we could do. So it's challenging. We've also had patients who had a particular insurance. They had a job change, the insurance switched, and now the new insurance is not going to cover the medication.
Because they were well controlled.
Because they made improvements on the medication. So, just some of these bumps in the roads and things that we found that has been a challenge, but we know that has been a challenge for everybody. And some of our patient education, this has been a little bit of a challenge, knowing that, realizing that there wasn't great education out there. And I think some of the frustrations on the practices and providers is wishing lessons learned. We wish we would have had this patient education and the materials sooner. Like, if we could have maybe, you know, gotten our staff educated and then had that patient education a little bit sooner, they, you know, maybe the rollout or things would have gone a little bit smoother, not quite as clunky if we had that. So lessons learned that, you know, just making sure you have all your tools in your toolbox before you start the job. And just the amount of time, you know, it's been a big change in time and effort across our staff. So a lot of lessons learned there, and just, you know, recognizing the need for engagement within the practice and especially within the providers. If you don't have great engagement, it's hard to get everybody on board and to champion and to make those improvements that you're all desiring. But then too, you know, with that and prioritizing needs, every office is dealing with challenges. So recognizing that, you know, lessons learned and trying to figure out how do we ever make workflows away from COVID, you know, and try to get back to doing the work that we want to do. So it's hard when you've been stuck in this one lane for so long that you feel like, how do we vary from that when there's still that need? So, but things to take away, you know, for success. Things that we, you know, that worked well, key takeaways for implementing this, like we said, and I think an absolute must is to making sure that you have a provider in each practice that really is engaged and is going to champion this work. You know, looking at staffing your practice structure, how is this going to look, and just really communicating that constant throughout the practice, throughout implementation, providing education, and just being open in your communication about what your goal is, and, you know, making sure that everyone understands the impact that it can make.
And I think also, we talked a little bit about the prior auth issue. The practices that identified that early and got a good process that took it off with the provider were the most successful. And so we know that prior auth isn't going to go away tomorrow, but if we can figure out what that workflow is and what staff are going to be responsible for it, our providers were much more likely to engage because they weren't being influenced by that as much. And so they felt confident that they could order it. And if they needed to do something else, someone would bring it back to them. When they weren't in charge of managing that prior auth process, it was a lot more successful. So I would encourage you to put that on your list for your practices as you look at, and so that there's, you know, somebody responsible for kind of babysitting that process.
Yeah, and so this is one other story I just thought was great, talking to one of our care management staff. So this patient, we'll call him Roger, called our care manager for an update. He said he was doing much better. He started his medications, which previously was not taking consistently. So this was good that he was starting to take the medication and taking it regularly. And then he was finally checking his blood sugar regularly, started on Trulicity. And as you can see, his blood sugar log was much, much improved. You know, she congratulated him on the progress that he was making, even said that his wife was following his new diet, and which was really helping him stick to that. You know, and just, you can see the changes in his diet. He was eating more protein for snacks. And when they were going out to eat, trying to limit the amount of carbs that he was having, and just stating that, you know, it was getting easier for him to eat this way. And he was feeling a lot better. So, you know, not feeling so tired. So again, just another really great example on the education through a low carb diet, you know, from our care manager, as well as the provider in that practice, and starting him on Trulicity and just the improvements that he had. So it was just a great example of a patient's success. So then the last thing, our hopes and dreams for the future for all of us. would be to expand coverage for all payers for these medications and CGMs, and having a good way to fast track our prior auths for patients, because we all know that sometimes it just feels like it takes decades to get them approved. So if our hopes and dreams for anything, it would probably be this amongst all of our practices. And that's it. Thank you so much.
Thank you so much, Brandi and Beth. That was absolutely fantastic to hear, and we really appreciate you sharing that with us and also coming all the way from near Traverse City to be at this meeting.